Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
I'm WVUA 23's Ashley Berry, and this is Health Matters. Today I'm here with Dr. John Mcdonald, who is a clinical professor at the College of Community Health Sciences. And today we're going to be talking about health considerations when airline flying. How are you doing today, Dr.
I'm doing
McDonald?
well. Thank you for having me.
Thanks for being here. Can you start by just talking about kind of what our bodies go through when we're flying?
So, a lot of people don't realize, but when you get on an airliner, you are basically elevating from sea level to around 35,000 feet. Airlines are required to keep the cabin pressure at around 6,000 to 8,000 feet. And for most people that don't have any health problems, that does not create a big deal. But if you've ever been out to Colorado skiing and you get into thin air, it can exact some tolls on your body that sometimes are unexpected, and primarily it relates to your heart and your lungs. People that have lung issues or cardio problems might find themselves in an airliner struggling to breathe, or maybe having heart palpitations, or in some other way their body's not adapting well, and that's usually where the problems come in, for sure.
And you know, we have spring break coming up here at UA.
That's right.
Lots of traveling happening.
Over 5 billion passengers are going to travel in 2026,
wow,
which is up from like 2 billion around 20 years ago. It's amazing.
Wow, that is amazing. Are there any like special precautions that students should think about, that their parents should think about?
Yes. First, where are you going? Is it safe to go? There are some countries that are on the do not travel list right now, so you always want to consult the U.S. website to know where you're going is safe. Number two, if you have any underlying medical issues, which for most young students, they don't have many. One of the primary problems we see with young people on airline flights is consumption of alcohol. You go from basically 50% humidity here in Tuscaloosa to around 0% humidity on an airliner. So it's very easy to get dehydrated, and the use of alcohol will expedite that. So I encourage young people, when you get on a flight, move around the cabin every couple of hours to keep your blood flowing, and drink plenty of water, and try to avoid caffeine as well as alcohol.
And what about for people who are maybe pregnant, who have chronic illnesses, maybe special different precautions for people like that? Talk a little bit about that.
So I am an OB/GYN by trade. One of the more common questions I get in my clinic is it safe for a pregnant patient to travel? And yes, it is entirely safe. The reductions in oxygen pressures on an airliner do not really present a problem for pregnant ladies. However, the risk of delivery, especially in the later gestational ages past 35 weeks, most airline companies do not want pregnant mothers to travel after 35 weeks because you don't want to have a complication while in the air, that kind of thing. The other common question I get is it safe to go through a scanner at the airport? And it is entirely safe for you and your baby to travel through a scanner. There are certain medical conditions, patients that have prosthetic limbs, maybe a knee replacement, or maybe they have a defibrillator or a pacemaker. They need to consult with their doctor to whether or not it's safe to travel through the scanners, and they can always opt for a pat-down.
And kind of on that line, say a medical emergency happens mid-flight, have you found that like flight personnel are prepared for something like that?
That has gotten a lot better. Actually, I was involved in a in-flight medical emergency about a year ago, coming back from Ireland, and on Delta, they have a medical kit now. It has an external defibrillator. It has all the medical instruments that you need, and it has a lot of medications that you need also. All of your cabin crew and your airline stewards and stewardesses are trained in basic life support as well as CPR. And so they can provide you with some help also during the flight. And the other thing that airliners are increasingly using is ground medical support. So the last time I was on a flight with a medical emergency, I actually consulted with a doctor on the ground. And we talked in a collaborative way about how to best care for the patient. And the ground-based medical support will help you in making decisions of whether or not to divert and land early and things like that. And that's gotten a lot better, for sure.
Good, good. And I read a lot about blood clots. I know some flights are very long and you're sitting for a long period of time. How can people combat that?
So there's a couple of things. If you're at high risk for blood clots, you can consult with your doctor, and sometimes they'll give you a shot to take every day called Lovenox, and you just take that prophylactically, and that helps prevent blood clots. You can also do some simple things like getting up, standing up, walking around the cabin every couple hours, and then you can also extend your legs out and flex your ankles. That helps a lot, and as long as you're moving around, usually that's sufficient to prevent them.
Nice. I also see, some people choose to wear masks on flights.
Yes.
And read a lot about like recycled air because you're in the air.
Yes.
Are people really prone to getting sick when they fly?
I was talking with our dean yesterday about this very issue. Airliners recycle their air. About 50% of the air you breathe inside the cabin is coming from the outside through ports, and it goes through HEPA filters. So actually the air you are breathing inside the airliner is probably cleaner than the air you would breathe in the airport. Now, with all that said, you are sitting in close proximity with other people. So the more risk of contracting a bacteria or a virus relates to the touching that you're doing on the seats and things like that. So we always encourage a mask is entirely appropriate if you want to, but wipe down the surfaces with a disinfectant pad. That's probably going to help you more than anything on an airliner.
Interesting. And I know I always pack a pack of gum because
Yes.
of ear popping. Am I doing the right thing with that, or is that just kind of inevitable?
Absolutely. So our body has cavities, and if anyone has ever bought a bag of chips and taken it on an airliner, you notice that as you get up in the air, the bag of chips expands, and some of them will explode. Well, your body can do the same thing. There are cavities, sinuses, as well as your abdominal cavity that does have some air in it. And so people that have recently had surgery, maybe a colon surgery or an abdominal surgery, we usually tell them if you have a surgical wound to wait at least 2 to 3 weeks before you get on an airliner, because that air expansion can sometimes bust wounds open and things like that. So you want to be really careful with that, for sure.
What about nervous flyers, like people who have a lot of anxiety in the air? What's your best piece of advice for someone who might be going through that?
Well, airline travel is one of the safest forms of travel there are. You're actually, I tell my patients all the time, you're probably more prone to have an accident getting in your car and driving down the road than it is to get on an airplane. And so obviously people will take many different forms of medication to allay their anxieties. Benadryl or Vistaril is a good one, as well as sometimes your provider may prescribe you a mild sedative such as a Xanax or an Ativan. And that's entirely appropriate if you need it.
Great, yeah. And does the work end when you land? Is there anything that you should do to recover, like maybe jet lag? I know a lot of people go through that. I mean, what's your advice for that?
Yes, I was reading today, jet lag is worse for people that are traveling from west to east rather than east to west. But jet lag all relates to our circadian rhythm. We're used to going to sleep at night at around 8 or 9. We're used to getting up at 6. Well, when your clock gets off, that's what creates jet lag. And my personal experience is traveling long distances creates the jet lag that is worse. So you can always take mild sedatives such as melatonin or a sleeping pill to try to help get your body back in rhythm.
Nice. Well, thank you so much for being here with us today.
Well, thank you for
Dr.
having me. I
McDonald.
appreciate it.
We appreciate it.
Thank you.